am José Güell, and I am working in Barcelona at the Instituto of Microsurgical Ocular de Barcelona, IMO, and I am directing the cornea and anterior segment department. My practice is basically focused on I would say 50% cornea, and including inside cornea, difficult anterior segment cases, and 50% cataract and refractive. Usually post-traumatic cases, or those cases where there has been complications in people with corneal trauma or corneal transplantation and lenses, are the ones that obviously we as anterior segment surgeons prefer as to enjoy with, not because. And in these kind of eyes, working with the MST instruments has been specifically useful. I would talk on, first of all, the need to take lenses out from the eye for different reasons, not only biometric errors or intolerance to multifocality, for example, but sometimes in trauma cases, sometimes when you have a lens and you need to take it out because you're going to do cataract corneal surgery, and then the refractive power of the eye will significantly change. So in all those cases, it's fantastic to have, let's say, instruments that gives to you confidence enough to work with. And I must say that your set of instruments for IOL exchange has been, for me, extremely useful to work through small paracentesis. They are robust enough to grasp lenses, but at the same time are delicate enough to grasp iris and other structures much more delicate than lenses inside the eye. Scissors works extremely well. They are built in a way that you can work through all the extension of your paracentesis in the same easiness. So I've been very, very happy using these instruments with this group of patients. The one with which I've been more time involved, designing it with you, is the capsulorhexis forceps. And well, might be perhaps my favorite because I have spent more time in its design than the others. I would say that in difficult cases, it's different than in standard easy cases. Possibly in a standard easy cases, I would say that the relation would be 50-50. So the instruments are important, the training and skills of the surgeon might be 50%. In really tough cases, I think that the relevance of the surgeon increases a little bit. But again, there are no surgeons able to do this kind of work with their hands alone. And so instruments are extremely important. When you have a fragile capsule, what you mostly modify are your surgical technique. So regarding how you manipulate the nucleus and the cortex, how you hydrate it in order to make them independent from the capsule. Sometimes you need capsule tension rings, sometimes not. Sometimes you will use intracorneal intrasaccular rings, sometimes not. So it's difficult to respond. You have a number of strategies and a number of devices that you might consider to use in that particular case and not to use in another. For example, I might have a significant number of pseudoexfoliation eyes where doing my standard phaco rolling technique and introducing a lens in the back will be my regular surgery. In some others, pseudoexfoliation cases, I will use perhaps the same technique, but I would decide to have a sulcus, 3 pieces sulcus lens with the optic trapped in the anterior rhexis, because I think that this case of pseudoexfoliation or partial zonulolysis, it's risky enough to, in the near future, has a complete luxation. So I will decide depending on the case. I would say that the example might be a driver of something risky, for example, a plane or something like that, that although you have standard activities and you love to have situations where the standard behavior is the rule, because then the possibility of having problems is less. The reality is that there are a significant number of situations where it is not a standard, and you need to take decisions. And you need to take decisions which are related with your own experience and your dynamic experience. So more or less, if you're flying, no, you need to take sometimes decisions that are different than your standard approach.